Okay. Hi, everybody. My name is Michal Linial, and I'll presenting a work on predicting endometriosis and building a model. This work was led by Ido Blas in my lab and with our partners. And there is also a poster that you are welcome to see in the tonight. Okay, so what is it, endometriosis? Actually, it's a condition in which endometrial-like tissue are found outside of the uterus. And as you can see in this in this scheme, there are many lesions, mostly in the pelvic tissue and organs. And actually, it's a chronic disease, extremely unpleasant. So it comes with a lot of symptoms. I just mentioned few. Some of them are chronic inflammation, but it comes with a severe pelvic pain and a large fraction of infertility. Moreover, fatigue and depression and so on and so forth are coming as a byproduct of this situation. So altogether, it's really impact quite dramatically the quality of life. Unfortunately, the diagnosis itself takes even now between 4 to 10, 11 years from symptom to diagnosis. And one of the reasons is that, first of all, doctors are not aware of it, or at least were not in the past. And the really definitive diagnosis is based on surgery, and non-invasive methods are only now slowly developing, but they are not available in most cases, and no biomarkers. So all of it cause a huge lag between the symptom and diagnosis. So if you never heard about it, don't feel bad, because despite the fact that 6 to 10% of the women in reproductive age suffer from this endometriosis, but we know that it's only recently became, the awareness has been changed. And in terms of numbers, I already mentioned that 1 of 10 women suffer from this, but I think most important to mention is that about 70%, 68% of the women that have it were misdiagnosed with some other disease previous to this definitive one, which is quite unbearable number. So what we know and what we don't know. We don't know much, but we have a list of what could be relevant to endometriosis, including inflammation and hormonal, steroid hormone, oxidative stress, and so on. However, basically, the factor affecting mechanism are mostly missing. Saying that, we decided to go into an approach of machine learning, quite classical one, in which we put the input and validate the result. And the data we used is the biobank, which is a really extremely rich resource. We heard a lot about it in this meeting, with 500,000 people recruited from 2006 to 2010, and the age of those population is between 40 to 70 at that time. More importantly, they have a lot of information from the medical record, diagnosis, lab test, and so on, but also, not as importantly, the self-reporting about through interview, about pain, about mental disease state, nutrition, and so on, including genetics. So can we use this UK Biobank analysis for endometriosis? And the first thing we did, we take everything that is known from the literature, from expert, and we ask by the univariable analysis whether there is those risk factors that are known are relevant. And the answer was surprisingly saying that most of what is known irrelevant, at least in the sense of having a statistical validation for this factor. And that include a list of those issues that were supposed to be factors. So one thing that I want to mention is that many of those factors were not proposed to be a strong indicator for endometriosis. So what could we done differently? We took the UK Biobank and filtered out, leaving first only Caucasian, like a European origin, And we were ended up with about 6,000 women which were fully diagnosed. And of course, those are the highly symptomatic women in the population. Actually, we have another analysis with the all other ethnics, which is over 7,000 patients, but their results were quite similar. So just to say that the average age of those with endometriosis was 42 years. Now remember that there is 10 years delay. So they are really in their fertility or reproduction age. And the first thing we had to do is to get rid of all the biases, and some of the biases coming from this awareness, late awareness. So what you see here in the left side is how the distribution of age look like, and we had to do some tricks in order to remove these biases and other biases that I don't have time to discuss. So altogether, we developed 3 models, predicting model. One is only based on genetics, the other only based on diagnosis. And when I say diagnosis, I say diagnosis before the endometriosis, so all the history, let's say, of the medical record. And the third one were related to the risk factor that I mentioned before, and the combination of those models. Unfortunately, when you look at the genetics, despite tens of GWAS, the information was really very minimal. And we can discuss later why, but it failed to explain the variance in the population. So what can we do? We did this model trying to understand the many diagnoses, and you can see that the endometriosis and not endometriosis have difference. And we found that aspect related to pain, to migraine, some to asthma and so on, and depression would become very informative. So unexpected ICD-10 diagnosis become relevant. Moreover, if you look at the left, we see, as I mentioned, the number, just the number of diagnoses to women with endometriosis. I'm talking before the diagnosis. It's much higher than the regular population. So we put all of it in the model, in the cat boost model, and we were able to receive quite good accuracy and good precision with a little bit of lower recall. Now, this is the different model. You can see that the unified model prefer the best with the AUC of 8.81. And when we compare different algorithm for modeling, we were able to show that the X-Boost and the Cat Boost perform best. And just to wrap up, we were able to look at the SHAP value to see who contributed maximally to this model, to the success of the model. And we were able to see, this is the first 20 listed out of 300 or so. And you can see that some of them are expected, but some were a little bit surprising. As you can see, the ICD count was very informative, including birth weight and all kinds of parameters that we didn't know before, including IBS, which is a wrong diagnosis that is happening quite often. So to wrap up, what I showed you is that we were able to show a new insight on endometriosis. We were able to show that the EMR, the medical record, were extremely informative. We were also very pleased to work with clinicians because we learned a lot from patient view rather than from bioinformatics, puristic, computational, and that was a very important experience. We revisited many of the risk factors that are written in Wikipedia, just revisit it. And the identical result were for European and the other ethnic group. And currently we are testing the model on unseen data. We take the Israeli endometriosis pool, and we would like, of course, to share this information with the medical community to really make it available to anyone. And I think I'll stop here. And just to say that if you want to read more, you can come to the poster. But this paper was just published in Journal of Personalized Medicine. So I think I'll stop here, and thank you very much. up, I can hear it. Yeah. You are seated. Sure. Okay. I think it's important, yeah. Yeah, so I mentioned it very briefly. We started with European, and actually we filtered out a lot of people that have even family connection to make it really pure in a sense. But in the end, we added everything that was there. So we were expanding by 30,000 more people that are coming from different ethnic group. And I didn't show the result, but there was zero difference. So somehow I think all those factors are shared by any other ethnic group and population structure. So what we did, I didn't go into the detail, but what we did, we put aside, 10% we never looked at. We did so we did the standard within the UK Biobank. As I mentioned, we are doing now in a different independent completely cohort. Yeah, we can talk offline. I'll be happy. But I'm giving another talk in the other room. So thank you very